Hey everybody, Digital Lion here. Tonight I have two local doctors talking about the impact of the coronavirus here in Bucks County, Philadelphia area, Dr. Luciano and Dr. Shiloh. I thought it was important to get some of the facts straight, some of the information out there straight, and how it's also impacting their businesses. The medical field's being impacted too. Let's grow your business. Let's stay strong. We're gonna get through it. Enjoy, watch the show. Talk to everybody soon. Let's effing go. Lion out. Hey, Dr. Shiloh, Dr. Luciano, thank you guys for being here on a Sunday. I am Lance Bachman, aka the Digital Lion, and I asked Dr. Luciano and Dr. Shiloh to come on today. I actually called them last night because so many people were texting me. I'm on the phone to clients all weekend. What's going on with the virus? There's so many myths out there, so many things. So I said, I know two of the best local doctors that I know that I trust my family with all my heart, and I would recommend anyone. I asked you both to be on here just to kind of go through what's going on with the coronavirus locally, nationally, give us your thoughts and opinions. And I appreciate you guys coming on today. I know you guys are busy, and I appreciate you guys taking the time. So thank you so much.
Absolutely. Thanks, Lance, for having us.
Thanks, man. So the first thing, Dr. Luciano, I'd like you to go first, and Dr. Shiloh, if you can go. Can you explain to the viewers what the virus is and what is CO-19, COVID-19?
Sure. COVID-19, yeah. So I think it's important to get a little background on the virus to understand why it's so important. It's a virus that was originated from animals, passed along to humans. It started in China. Like any virus, it requires a host to replicate. In this case, seems to be more contagious and deadlier than the seasonal influenza virus. So originated in China, and now it's spread globally. So it's considered a pandemic. So over 169 countries have it now. 300,000 confirmed cases, 13,000 deaths. And in the U.S., we're seeing about 30,000 cases, over 300 deaths. So it's a unique virus because the incubation period is only 1 to 14 days. So you could walk around being able to shed and spread this virus and not know it. It seems to live on surfaces longer than most viruses, so it can stay on the desktop for days. You can contract it without knowing it. And the death rate, seasonal influenza, 0.1%. This looks like more like 2 to 3%, so much more. So very contagious. It's deadlier. It's being exposed all over the country. We anticipate most Americans will get it at some point. And those that require hospitalization are 10 to 20%. So those are the facts there, and that's why it's an important health issue at this point.
Dr. Shiloh, can you give us your take?
Well, yeah, I mean, Dr. Luciano covered a lot of the basics about it extremely well. I think the thing to remember is the virus has exponential growth, which means that the number of patients you'll see is going to double every 3 days. And so what's going on right now as far as social distancing and what we're trying to achieve as a community, as a medical community, is an attempt to reduce the peak, to slow it, to take the curve and make it bend down lower so that the hospitals do not get inundated with all the people all at once. As of today, this is as of this morning, there are 27,000 total cases in the United States, which is significantly increased, but we're just behind China, Italy, and Spain. And, we are obviously working hard as far as social distancing to try to contain this thing. But we have to remember that we have to listen to our doctors, to wash our hands, don't touch our faces. And of course, one of the most important things we can do right now is just to keep ourselves as far away from each other as possible. It's very hard to socially distance, but it's the one thing we can do as a community, work together to get through this as soon as possible.
Well, I'm glad you brought that up. You brought up social distancing. You didn't use the word quarantine, but you said stay home, and you said healthcare system. The number one question I'm getting asked by a lot of business owners and a lot of people is, the death rate doesn't seem to be that high. Some people are arguing, saying it's actually getting less if you look in the United States, not on a global level, for people that are catching it. We're quarantined. People are quarantined. And you said the health system. Dr. Shiloh, can you go first and explain to people really what the issue is and why they're saying what they're saying to us as people?
Well, yeah, I mean, it is possible that the death rate in the United States is lower. We do have an amazing healthcare system. We have all the best doctors and all the best tools and all the best medicines. However, the problem that we have and the reason that we're social distancing, and in some locations like California, now New York, quarantining ourselves and others, is that without that, the amount or the influx of people into the hospital is going to be so significant that the hospital just cannot keep up with it. There's a limited number of intensive care unit beds. There's a limited number of ventilators. There, on any given day, they are used by people who are having heart attacks or having other medical problems, and thus it's not just sitting there open, ready for these viral patients. So that's one of the reasons why, even though the death rate is low, and I think that's a testament to our excellent medical care, the problem is that we're going to continue to see an exponential rise in the number of patients, and even if only 10% of those patients need hospitalization, at some point the number of patients is going to be more than the number of beds, and we are going to be in a serious situation. So that's why we're taking this social distancing, quarantining very, very seriously. And should.
Sorry, Dr. Shiloh. Dr. Luciano?
Yeah, good point. It's also important to know that the testing, so the testing is now becoming more widely available. So now we're going to see a lot more cases. Plus, this virus spreads exponentially. So it's in its early stages in the U.S., and you're going to see as the days increase, the virus will increase, the deaths will increase, unfortunately. So what we do now is extremely important to make sure that rise doesn't occur more exponentially than we need it to. So if you look at New York right now, New York's going through a big problem. There are many more deaths than anywhere in the country, but they're testing more. There's more density there. So the social distancing aspect is difficult to control. But you're seeing this now start to become more of an issue as those hospitals become saturated. The ICU beds, the ventilators become more of an issue. And that's a good, a predictor for what's going to happen for the rest of the country, because we're all basically being exposed and at different rates.
So here's a question. A lot of myths out there. You can tell me, we got a few of them I laid out for you. Some people are saying you can only get this once. You can protect yourself by holding your breath. Hand sanitizer or soap. What's the difference? Eat garlic will help prevent the infection. You only have to worry about this if you have health problems or you're older. They're the 5 biggest myths we came up with. Dr. Luciano, can you tell us what you think about those things? Are they true, inaccurate?
So I can roll through them real quick for you, but some of them are silly. But I think information is important to get your information from the right sources. So the best are the CDC and the World Health Organization. Those are the ones on the internet. That's where you get your information. Everything else, I'm not sure how the truth to that. So what I would say quickly through that, garlic is it's healthy for the immune system. It's not going to prevent you getting the coronavirus. It's important to keep a nice, healthy immune system, good diet, sleep, rest, some sunlight, vitamin D. But garlic is a good, healthy add-on to diet, but it's not going to prevent you from getting the virus. Hand washing is, extremely key. 20 seconds hand washing is, the best way to get the virus off your hands. It's not always practical to be able to wash your hands every time you touch the surface. So that way, hand sanitizer is the second best. You need something that's about 60% alcohol. But the same thing with hand sanitizer, you got to apply enough on your hands to cover every area. Be sure they're not greasy or filled with dirt. The other thing is make sure it dries after use. If you touch something when it's still wet, you're not going to get full coverage there. Holding your breath for, that's just a silly myth, I guess. Some people believe that. It's not the case. This thing lives in the air for a bit. You need to keep a 6-foot distance, lives on surfaces for days. So that's not, that's not an adequate way to protect yourself. Masks, the N95s are the ones that healthcare workers need. No one needs that in the community. These surgical face masks people wearing, doesn't cover your face completely. So that's not going to be complete protection. A lot of people fumble around with the mask in your face. You're touching your face. You're probably at more risk for that. So, people that should be wearing masks in the community, it's just ones that have the infection probably. So I think those cover most of it. Aaron, do you have anything to?
Dr. Shiloh, can I ask you the question about the concerns of the health? Is this only affecting elderly people like people think and people with health issues? Because I'm hearing it's now infecting children. Can you tell us the facts, Dr. Shiloh, please?
Yes, I'm glad you asked that question. I think it is probably true that our sickest patients are the elderly, people who are over 65 or 70, which we never really considered old, but in this particular case, they are the ones who are most predisposed to succumbing to the illness, to dying. Okay. That said, there are numerous reports of young people who are sick in the hospital. I can tell you I'm personally aware of at least 5. I'm talking about doctors who are otherwise healthy. I'm talking about men who are otherwise healthy who are now in the intensive care unit somewhere, intubated and fighting for their lives. So that's not the case. And in addition to that, one of the things that's most concerning and is that young people can act as vectors for the disease. And that means that you may be a relatively asymptomatic carrier. You don't feel real well, whatever, no big deal, it's a cold. But then when you interact with someone else who's older or has is immunocompromised or has some illness, like they have cancer or some other illnesses, respiratory illnesses, you can easily infect them and be the one who is responsible for that person being extremely sick. As an example, yesterday, after taking a walk, I noticed young men playing, skateboarding, basically on top of each other, playing pickup basketball games. And I know it's tough to do, but those things are really, really not proper right now. You may feel invincible and you may feel like you're not going to be sick, but if you make someone else sick, I just wonder how you're going to feel later when you feel responsible for your mom, dad, or other loved one getting ill from this disease and it was preventable. We just need to take a few weeks off. And if we can do that, we can really reduce the impact of this disease.
Well, I know, and I appreciate that. I know you both have practices. I know they've both been growing. I know you both have been very successful doctors. My question to you both is, how has this impacted your business? Because this is a marketing show also about businesses. So how has this impacted your businesses? And what are you using? Anything like telemedicine, staying in front of your customers? If you don't mind telling your patients, I apologize, to keep going. I mean, how is this? Because people think that it probably hasn't impacted your business. I'm assuming it has, correct? Both of you? Dr.
Yeah.
Luciano, you want to go first?
Definitely. I mean, so I'm a small business, so not only do I provide primary care services, we do wellness, integrative care, we do aesthetics. So I shut all that down. So I'm very much impacted, and I feel it. I feel the pain out there that everyone's going through. How I'm doing my part is I'm ramping up my skills as a primary care doctor, understanding there's a big need in the community to address a lot of health issues that are not coronavirus related. I mean, there's still patients that need continuity of care, the chronic conditions, refills, other issues. So telemedicine has been a huge part of my practice even before this. So we do virtual visits, text, email. Patients in my practice get a hold of me all the time, 24/7. I think virtual visits and telemedicine is where you're going to see things going forward. People need a social distance, but they still need care. So I'm opening up my practice for that need for patients in the community that just need those one-time visits to take care of acute issues, rashes, coughs, congestion, this and that, stuff that's not necessary corona, but I can direct coronavirus issues and tell them if they need testing, order testing, and also refill medicines. So it's important that we don't ignore our community's health, and this is the best way to safely practice social distancing and be able to continue good care of our patients to keep them healthy.
Dr. Shiloh, you want to add anything?
Sure. I mean, as a interventional radiologist and a radiologist, I'm aware that what's happening is that in the radiology world, we're really cutting back on, again, non-emergent imaging that can wait. It's tough for you when you want your knee x-ray or knee MRI, but unfortunately, that is something that's going to have to wait. Obviously, I also work in an elective-based business doing fibroid embolizations and vein work, and that's severely affected right now. We're not, these are things that unless you have a blood clot or bleeding severely from fibroids, you're really going to have to wait a little bit until that happens. What I'm personally trying to do is, again, also ramp up my own medical knowledge, because I suspect that in the near future, I will be drafted again, so to speak, using a war terminology, and I'm looking forward to finding a way to help and put my services to good use at one of the local facilities, doing whatever I need to do to help out. So yeah, we're all affected by it, and we understand the pain that everyone's feeling. And I guess that messaging would be that we're all experiencing this, and it's painful for everybody. And the sooner we all adopt the appropriate strict measures that are being recommended, the sooner we can all come out of this as a society, as a community, and maybe even stronger as a group. But it's going to be tough. But you know what? If we can manage this for a few weeks to be really strict about what we're doing, I think it's going to shorten the duration and the impact of the disease. And hopefully everybody can go back to some sort of normalcy.
I guess one of my questions for you, Lebron, that is, it is such an unprecedented time in the history of our country. On a local level first, and then on a national level, right? Because a lot of these people that are going to watch this show is going to be local, and then some national across the country. But here's a question for you. what is our biggest challenge right now at the healthcare system? Because I hear a bunch of different things. What's the biggest challenge on a local level here first, Bucks County, Philadelphia, DMA, South Jersey, and then cross nationally? Dr. Luciano, if you want to go first, and then Dr. Shiloh, you can add.
Yeah, definitely. So, we talked about access to healthcare right now when patients are staying home, what are they going to be able to do with their other medical issues? So I would advise patients to check with their doctor. A lot of them do have this telemedicine service, and there are now insurance companies to be able to reimburse that potentially for some people. And, I'm willing to help out the local community as well. I think we just released up on Facebook. You go to my Facebook that allows you to get a visit. At a national level, and also in the community, is the lack of equipment for healthcare providers. So the major issue here is personal protective equipment. We're all supposed to stay home, but the people are going into the fire, the front lines. Those people need protection. They need equipment. They need masks. They need gloves. They need gowns. There's a national shortage. Some people are hoarding this. This is a big need for these hospitals to have, so that way we can care for the sick and the caretakers don't get sick. So the government hopefully is going to be supplying that. There's going to be big production in the time being. If anyone can donate supplies, I just had a patient the other day has 500 N95 respirators, going to donate to the hospital. Really nice gesture. So people are coming together here. Just need to be aware of what the needs are. I think if people are acting, graciously and appropriately.
It's funny because I saw yesterday a friend of mine, Matt Ratchab, MRB Painting. He found a bunch of masks and he took them to Chop and Pen. And he's a painter, and he had 500 masks. And someone said to me, "Why would he do that?" I'm like, because he gets it. It's bigger than his painting company right now. This is about his local community, and this guy loves his local community. He's one of us. He's a self-made guy. And, the question was asked by someone that obviously wasn't a business person, has no, in my opinion, intelligence. I hate to say that. But it's, you see a guy do such an act of kindness, what you said, the guy with the respiratory equipment. People don't want to give away their things. They paid money for them, but they understand the why at this point.
Absolutely. He gets it.
Dr. Shiloh, you want to add anything real quick? And then
I would just second what Dr. Luciano said. I mean, personal protective equipment is really critical right now. You have to remember and keep in mind that with the shortages of ventilators and all that, those ventilators require human beings to run. Respiratory therapists, there's nurses, there's ICU doctors, and a whole slew of people in the chain that require that need to work with those patients, your loved one. Okay. And if some hospitals, the largest ones, may have a large supply of respiratory therapists, but if you look locally at your local hospitals here, I could speak to Holy Redeemer, St. Mary's, Doylestown. They're not going to be 500 respiratory therapists. There's a handful, and on any given shift there may be one. And if that one person doesn't have a mask, or if that one person gets taken out by the virus, there's one less person. We don't have enough people to run those equipment. There's many, many ways that it is very, very, you don't think it through. It's not just the doctors like us on the front lines. There's a gazillion healthcare workers, x-ray techs, you name it, who need this equipment. And it's critical for them to have it.
Great point. Here's one question, and then I'm going to let you go because I know it's Sunday. I might ask one or two more. For people watching this, because this is probably the hottest topic right now besides marketing. No, I'm joking, but clearly is the hottest topic out there right now.
Toilet paper.
Yeah, right, and toilet paper. But here's a question. Should I be scared? I have 4 children, right? And I love my brothers and sisters and my family and my mom, but I have 4 children. Should I be scared at this point about this virus? Because that's what people are asking me. Are you scared? Is it real? Is it a hoax? I mean, I see people, even my own friends, like someone just think I'm being paranoid because I don't want people in my house. And so, like, doctors, can you answer that question for me? Shiloh, if you want to go first, should I be scared?
I don't think scared is the term I would use. I mean, you need to be rightfully concerned and prepared, and use the information like Dr. Luciano was suggesting from the CDC, from the World Health Organization, and from your local doctors to prepare. What you're doing is actually appropriate. And as you know, Lance, I've been advocating this for weeks myself, and have gotten a fair amount of flack from others who have felt that I've been overreacting and such. The sky doesn't have to fall as long as we adhere to the appropriate rules and regulations that are been determined by the healthcare professionals in this world, and from the CDC and to local doctors. If we all listen, we all play well in this situation. If we do what is important and monitor ourselves, our family, and take care of ourselves, we can end this sooner rather than later, which is good for our health. It's good for our economic health. It's good for everybody's business, and it's good for America. And so we just need to try to be really sound and sane about what we're doing. And, yes, there are people who are going to be out there saying it's a hoax or it was a hoax, whatever. Clearly, that's not the case. What is clear is the sooner we abide by the rules and the ideas that have been set forth, the sooner this thing can be over. So you need to just be realistic, be prepared, and listen to the appropriate medical authorities, and then take it from there.
Dr. Luciano, you want to add anything?
Yeah, I mean, I think it's natural human nature to be scared. I've been scared. There's emotions you go up and down with during this whole unprecedented time. So I think that's a natural reaction, and justified. So, but the main point to take home here is this will pass. We will get through this. The question is, how severe will the damages be? How many people will be affected? And what we do now directly impacts that result. So it's really important to understand everyone's in this together. We're all brothers here. We're all going through the same downs and ups. We're all worried, but you know what? We'll all come together, and I think ultimately be better for it down the road as we look back. But it's tough times. It's I can relate, but it's something that will pass. And putting things in perspective is important. Getting your information right, being educated what to do, so we can make the right choices.
Good. 2 more questions because I really think they're important. I've been hearing a lot of different news. I have one friend that couldn't get a test. I have another friend. Actually, I'm not going to say who it is because I don't want to put information that went and got tested. So one person couldn't get a test, the other one could. Is there more tests out there locally? Because both of these people are local, and one couldn't and one could. Can you tell us, is there more tests here locally in the Bucks, Philadelphia, DMA area, South Jersey, or is there not? Is that a myth? Is it true? Do Dr. Luciano want to go first?
Yeah, sure. That is true. There is more testing available now. Probably a week ago, a lot harder to get a test done. There's not that many available then, so the requirements for testing were very strict. So you had to have a contact with someone that had a positive test. You had to have traveled to one of those high-risk countries and symptoms. And now, as a provider, you can basically get a test if it is a patient that has symptoms and is at high risk, elderly, chronic medical conditions. All it takes is an order. There are drive-through places to get it done. There's commercial labs, not just the state health department that will approve. So yes, there is more testing available, but it's not everyone should get a test. It's also an important point. It's the patients that are high risk symptomatic at this point. If we're just going to change our recommendations about what to do. If you're sick, you're healthy, stay home, stay isolated. And as testing becomes more available, quicker turnaround times, those recommendations will change. But for now, it's improving, and it will continue to. And been able to get some tests for patients already.
And then I want to ask for some information. Here's the biggest thing I'm getting. My clients are calling me every day, potential clients. My team's working 15 hours a day. It's just been insanity, right? The last 2 weeks. The last week has been crazy all weekend. It's Sunday. You guys are working. I'm working. A lot of people out there working. The economy is being affected so hard right now. Do you see an end in sight? That's the number one question. When do you think this will end? How do you think it ends? You guys own small businesses. I own a small business. A lot of people own small, mid-sized businesses. Can you give us some insight on that? I know you guys don't have crystal balls, but from your perspective, can Dr. Luciano go first and Dr. Shiloh?
So I think it depends on what the impact of what we're doing now, how it's resulting in the decrease of cases. And I think there's a couple factors in play. Number one is, what are those results over the next couple of weeks? If what we're doing is working, we need tighter restrictions. So I think in the next couple months is when we're really going to know how long this thing will last. And a couple other factors. Number one, how tightly do we adhere to these recommendations? Is there going to be some medicine that's going to be effective to decrease this spread, also to decrease the symptoms and severity and hospitalizations? There's some promising meds out there, so I think we'll know some more data over the next month. Vaccine's going to be a long ways away. So those are the two things right now that it will predict. And my prediction, I think, is going to go for 4 months minimum. It could be upwards of a year. 4 months minimum year. Dr. Shiloh?
I would echo what Dr. Luciano said, in effect, that whatever we do now, the way that we respond will affect it. And we can look towards the data that comes out of other countries and their response. If you look towards what happened in China and the way they shut down Wuhan, the way that South Korea tested at a rate that we haven't seen yet here, the way that Singapore responded, they were able to flatten the curve. You hear that all the time. Instead of it spiking like way up, we have a more flat curve. What it does is allow the healthcare system to deal with people on a more gradual basis. And to his point, who knows, in a month or two, there may be more medicines. There's been some talk about some medicines. I know Lance and you and I spoke about some like Plaquenil and others. There's some small studies showing its efficacy. And while it's very exciting and we hear people very excited about it, there aren't enough large clinical trials. Gilead Pharmaceuticals has a drug called Remdesivir. That drug is on a compassionate use basis. But the longer we can prolong the peak, the more likelihood there is that the data will come out and drugs will be available that can help people. So if we can really adhere to what we're doing and really stick with the social isolationism as much as we can, this can be over sooner than later. And then I would make another point. Even if in 2 months we're allowed out again, it's over. If we don't, it's going to probably, what epidemiologists and virologists say, will peak and come back and come back and come back. So we need to flatten this curve as much as we can right now. Let the medical doctors who take care of these sick patients in the hospital deal with it to the best of their ability without being overrun. Will give us time to ramp up our production of ventilators and of personal protective equipment, allow for more medicines to come out. Is there an end in this? I don't know that there's an end. The real end is when everyone gets herd immunity, which is about 80% of the population gets affected. Then as a group, we're all immune and protect others from being so. But that's a long ways away. So the better we can adhere to the policies of our CDC, the World Health Organization, local doctors, the shorter time it will be before we can get back out and back to business. So the truth is, there's no known site. I would tell you my prediction is that in a couple months we may be able to get outside for a little bit again, but we have to be very, very clear that at that time it could still come back again if we don't retain some of that element of social isolationism.
Dr. Shiloh, if somebody has questions for you, wants to reach out to you, where should they go to reach out to you, Dr. Shiloh?
Well, there's several ways. I have my own website, drshiloh.com. I also work for USAVeinClinics.com. I'm available through there. And to be honest, people find me on Facebook and on other social media platforms. On Instagram, I'm Dr. Sclero. And on Facebook, I am Aaron Shiloh. You can find me and message me. I've helped many people through their fears, anxieties. And then what I typically do is I refer them to doctors like Dr. Luciano and others who really are the frontline soldiers against this disease. I'm more of a specialist in the background, but I'm happy to answer the questions. I've educated myself tremendously on this virus. I have access to a lot of interesting information through large national and international groups of doctors who are fighting this disease. But really, on a local basis, you really need to talk to your primary care physician like Dr. Mike here. And, usually if I get asked something and I'm not able to handle it, I forward them along to doctors like him and others who are really the frontline soldiers right now.
Dr. Luciano, if somebody wants to get a hold of you and talk to you about this.
Sure. So we have a website, www.drluciano, drluciano.com, as well as our Facebook pages where we're offering our telemedicine visits for new patients. It's Concierge Family Medicine, Dr. Luciano.
Everybody, doctors, I appreciate you coming out. I know it's a Sunday. I know you're busy. Everybody, I hope you enjoyed it. You got some straight shooters here, some great doctors here locally, giving you the down and dirty what's going on. Digital Line out. I will see everybody Monday. Thank you and enjoy your day. Guys, thank you so much. Enjoy your Sunday and get back to your families.